Can you exercise with chronic exertional compartment syndrome? I'm Dr. David, orthopedic surgeon and sports medicine specialist. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Chronic exertional compartment syndrome is a really difficult problem for people that love to run especially, but you see it sometimes in cyclists and some other sports that involve a repetitive motion. But it's usually running sports or people that just run for exercise, and it can be really tricky. Often ends up needing surgery. In today's Ask Dr. Geier video, somebody asks me about whether or not they can continue to exercise essentially with the problem before having surgery. Jerry asks, "Hi doc, I'm officially diagnosed with compartment syndrome. I'll start my first physical therapy session in a few days and possibly surgery in 4 months if physical therapy won't help. Is it okay if I keep exercising before surgery? I hate to be inactive for so long. I plan to avoid running, but I enjoy walking a lot. Is walking okay in your opinion? My muscles often felt tight after walking and a little sensitive, but not too bad. Also, is swimming okay in your opinion before my surgery? Thanks a lot." Okay, terrific question, and Jerry asks something that patients in my office ask quite a bit. First of all, and I've got other videos on chronic exertional compartment syndrome, so I won't get too much into it, but when those muscles after running especially start to really swell and the leg gets tight, it can be really difficult and really hard to push through. Physical therapy is absolutely worth trying. In my experience, people that really have the problem, especially they test positive with the muscle compartment pressure tests, physical therapy a lot of times doesn't really move the needle in getting them back to what they want to do. Now, sure, you could give up running or whatever the activity is that causes your symptoms, but most people don't want to do that, so they end up having the surgery. But even before we talk about the surgery, could you exercise? Try it and see. Typically running is difficult, but if you can do it, I guess you're not doing harm to yourself. Walking can do it as well. That's why you see it in people that have it. A lot of times walking quickly at work gives them trouble. But again, you could try it. You're not doing harm. Non-impact activities typically go better. So cycling, swimming that he mentions potentially is an option, lifting weights. Try various things and see how it goes. If physical therapy is enough to get you better, great. But if it's not, and if you can't do what you want to do, then you at least think about having surgery for it. Okay, have you had chronic exertional compartment syndrome? What did it keep you from doing? What sports or exercise were you doing that it caused you trouble? And if you had surgery, how did it go? I'd love to hear your experience. So below this video, please share your experience. I'd love to read it, and I know people all over the world dealing with the same problem who are watching these videos. They'd love to read what you have to say as well. If you know somebody dealing with chronic exertional compartment syndrome, please share this video with them, and hopefully they might have an idea of what they could do about it. If you like videos like this and you want more information on sports and exercise, injuries and injury treatments and injury prevention, subscribe to my YouTube channel. On my YouTube page, click the subscribe button in the upper right corner of the page, and I record a couple of these videos every single week. They'll get delivered directly to you. Thank you so much for watching. Again, subscribe to my YouTube channel, and I look forward to seeing you right here next time.